Hello, you're listening to Daily Coronavirus Updates. Today is the 29th of May and this is The Wire. The number of COVID-19 cases in India has climbed to 1,65,000. India is now the world's 9th worst hit country by the pandemic. The death toll has risen to 4,706 and a record jump of 7,466 cases was recorded today. Over 71,000 people have recovered from the virus so far. NCP MLA from Deolali, Saroj Ahire, tested positive for COVID-19 yesterday. Said to have been infected at a funeral in Mumbai, Ahire had been in quarantine for the last few days. He is the third MLA to have been infected by the virus in Maharashtra. While Housing Minister Jitendra Auhad has recovered after testing positive, PWD Minister and Congress MLA Ashok Chavan is currently undergoing treatment for the infection. Assam has reported a surge in the number of cases. The state saw the caseload double within 3 days. More than 800 people have now contracted the virus in Assam. The state health minister has said that over 90% of COVID-positive cases detected in the past 3 weeks were among those who returned to Assam from other states. 2 floors of the Parliament's Annex building have now been sealed after a Rajya Sabha Secretariat official tested positive for COVID-19. This is the 4th such case reported in the Parliament complex so far. Meanwhile, over 58 lakh people have been infected with the virus worldwide, and the death toll has risen to 3,60,000. Over 1 lakh people have died in the United States alone. This is a record number of deaths that America has seen. It is more than the number of Americans killed in the Vietnam and Korean wars combined. According to media reports, as many as 195 health workers at India's leading hospital, AIIMS in Delhi, have contracted the virus. Of these, at least 50 health workers tested positive within the last 3 days. Employees from all kinds of departments like engineering, laboratories, offices, canteens, operation theatres and wards, among others, have contracted the infection. The son of a senior sanitation supervisor at AIIMS told the Tribune that his father contracted the virus on the 15th of May and died on the 24th of May within 9 days. He said that on 15th of May, routine checks were done at AIIMS premise, but a COVID test was not done. His father was asked to return for a COVID test only after visible symptoms. He told the newspaper that N95 masks provided to sanitation workers at AIIMS were of low quality. On the rising number of cases, the General Secretary of AIIMS Resident Doctors Association has written that since March, doctors have been writing and fighting for improving safety of hostel premise, sanitation, provision of stay and proper quarantine protocol, but they have not got a satisfactory response. He added that even the issues raised by them about the quality of N95 masks provided and other components of PPE have not been addressed. He wrote that the N95 masks provided in many regions of the hospital do not even meet Ministry of Health's safety standards. In the end of his note, he said that if this continues, we will be short of healthcare workers to treat patients. At a press conference, Niti Aayog's V.K. Paul, a member of the Empowered Group on Health, said that the speed at which people are being discharged after treatment has accelerated after the revised discharge policy came into force. He added that before the new guidelines came into force, hospitals were discharging patients after some time based on certain conditions. Earlier this month, the Union Health Ministry issued a revised discharge policy, according to which moderate cases of COVID-19 and pre-symptomatic mild and very mild cases don't have to undergo tests before being discharged. But coronavirus-infected patients developing severe illness or with compromised immunity will have to test negative through RT-PCR before they are discharged by a hospital. According to a report published in the Indian Express, 3 girls, including 2 infants, died over the last 48 hours in 3 separate quarantine centers across Chhattisgarh. Officials told the newspaper that 2 of the deaths were caused by asphyxiation while the children were being fed. According to the media report, the 3rd child, a 4-month-old who died yesterday, had been ill for the last few days and her COVID test result is awaited. The other 2 who died on Wednesday, including a 3-month-old, was severely malnourished according to the sources of the newspaper. All the 3 were children of migrant workers who returned to the state after the lockdown was eased. Panic gripped Bishanpura village in Uttar Pradesh after some bats were found dead in the area. According to villagers, there have been incidents of bats falling from trees and dying in the Maniar police station area. Teams of health, forest, and veterinary doctors reached the village on Wednesday to take samples for testing. District forest official has told the media that the reason for their death will be known only after receiving the report. This incident has gained significance in the view of raging coronavirus pandemic, and villagers apprehend that the dead bats could lead to a problem. A similar incident was reported from the Belaghat area of Gorakhpur earlier this week. After the review meeting, Chief Minister Pinarayi Vijayan told the media that the state is on the brink of community outbreak of infection. He said that the number of positive cases has gone up. Most of them are from outside and infected through contacts in Kerala. He added that all cases with cold and flu would be subjected to COVID-19 test in the state. According to a report in the Indian Express, Kerala has also ramped up daily testing, which is being cited as a reason for identifying more asymptomatic carriers of the virus. A university in Germany has suspended clinical study using the anti-malarial drug hydroxychloroquine for COVID-19. According to a German language media website, Peter Kremsner, a medical director at the German university, said, "We will now probably interrupt the study for 2 weeks." He added that later an assessment will be made on whether to continue the study or not. Several European governments on Wednesday moved to halt the use of anti-malarial drug to treat COVID-19 patients, and a second global trial was suspended. Meanwhile, US researchers reported on Thursday that cancer patients with COVID-19 who were treated with a drug combination were 3 times more likely to die within 30 days than those who got the drug alone. The preliminary results suggested that doctors may refrain from prescribing the decades-old malarial treatment hydroxychloroquine with the antibiotic azithromycin for these patients until more study is done. However, 2 days ago, a member of India's think tank Niti Aayog told the media that India will continue its faith in the continued prophylactic use of the anti-malarial drug for the novel coronavirus disease. VK Paul said that evidence has been examined very thoroughly, including before making expanded recommendation last week for all frontline workers. Paul has also said that they will modify and expand the protocol as they go along and use it for both therapy and prophylaxis. That's all for today. You were listening to Daily Coronavirus Updates from the 29th of May on The Wire. We will see you tomorrow. Until then, stay safe.